If a medical provider has just said to you that a child whom you love has a brain tumor, you probably have feelings of fear and confusion. The words brain tumor evoke imaginations of incurability and impairment, and that makes you desperate for any facts that might bring you some hope. I would like to provide you with a first response to this stressful moment that may help to bring some clarity and perspective. My name is Dr. John Collins, and I'm the Chief of Pediatric Neurosurgery at the West Virginia University Children's Hospital, where we take care of many children and families from all over the greater West Virginia area who have also faced such a distressful moment. So first, let me tell you at the outset that a great many types of pediatric brain tumors can be cured with the proper treatment. Only a few kinds of brain tumors resist our best efforts to overcome them. Many others respond to modern neurosurgical, oncologic, and radiotherapeutic interventions that can cause the tumor to go away. You see, there are actually many different varieties of brain tumors, each with a specific name and its own distinct way of behaving. The word tumor itself is only a very general term that just means something inside the body that occupies space and is not supposed to be there. CT scans and MRI scans of the head see a brain tumor mainly because these scans detect the tumor's mass effect, the extent to which the tumor pushes against the normal structures inside. A brain scan cannot tell with exact certainty, though, which kind of tumor it has detected. Yet, the precise identity of which type the tumor is largely determines how effectively it will respond to treatment. Now, if a lump of stuff on the inside of the body is the kind of thing that can grow bigger as an expanding mass by dividing its cells into ever more new baby cells, then we call that tumor a neoplasm. See, but not all masses that occur inside the brain do that. Some truly benign tumors are more like lumps of otherwise fairly normal body tissue just located by developmental error in an abnormal location. They have names such as lipoma, dermoid cyst, or epidermoid, which describe the type of tissue that each one contains. Benign brain tumor, however, does not necessarily mean innocent brain tumor. It can be a worry if the location and size of the mass pushes on nearby normal brain tissue to such a degree that it begins to cause neurologic symptoms. So low-grade tumors are ones that tend to grow only very slowly and tend to stay in one place rather than spread around. They will grow bigger over time, but only gradually, and if they undergo complete removal, they have a low likelihood of trying to come back again. Names of tumors like this come from the types of cells that give rise to them. See, the brain has two well-characterized cell types: the neurons, which do the work of thinking and having activity, and their helper cells, which we call the glial cells. Such low-grade tumors might have names like a ganglioglioma. Now, because the glial helper cells in the brain come in a variety of types, such as astrocytes, oligodendrocytes, or ependymal cells, there are low-grade tumors derived from those cells with names like astrocytoma, oligodendroglioma, or ependymoma. If a low-grade tumor comes from a germination cell found in the brain, it might be called a germinoma or an immature teratoma. If it comes from tissue located where the base of the brain comes together with the tissue at the back of the pharynx, then it might be called a craniopharyngioma. Unfortunately, not all brain tumors are benign or low-grade. It can come to pass that some tumors will behave in a very high-grade manner, meaning that they will try to grow quite rapidly, try to spread themselves around by infiltrating into nearby normal brain tissue or by floating through the cerebrospinal fluid. Such high-grade tumors will also try very hard to come back again even after all attempts to treat them have been completed. 3 tumor examples that all exhibit high-grade behavior are pictured here. The anaplastic grade 3 fibrillary astrocytoma, which infiltrates into surrounding brain tissue. The high-grade pontine glioma, which grows larger very rapidly and cannot be surgically removed. The thalamic glioblastoma multiforme, which can be suppressed by a combination of multiple treatment modalities, but eventually breaks out of remission and recurs. The only reliable way to tell the difference between so many varieties of different tumor types is to examine pieces of the tumor tissue under a microscope in a pathology laboratory. The pathologist can then determine the exact identity of the tumor. For this reason, in nearly every case when scans detect the presence of a brain tumor, the first response will involve a cranial neurosurgery to remove all or most of the mass, to find out what kind of tumor it is, and to begin the process of eliminating it. Now, there are a few exceptions to this rule. Some tumor types might only require a minimally invasive biopsy, and some might not need any surgical intervention. But only through consultation with a pediatric neurosurgeon can the best strategy for the first intervention be determined. A pediatric neurosurgeon is a surgeon who first completed specialty training and underwent examination to become a board-certified general neurosurgeon. Then, after that, completed an additional subspecialty training and earned a second board certification from the American Board of Pediatric Neurological Surgery. You can find a list of board-certified pediatric neurosurgeons at www.apns.org under the heading Locate Diplomate in Your Area. I can confidently assure you that any one of the board-certified pediatric neurosurgeons that you find on that list will have the superlative expertise and the compassionate manner that it takes to help you and your family through this frightening moment in your life.